Hello friends, welcome to the second part of it. This is the process where the dilute urine is formed. We can see in the figure as usual normal. Here in a in the proximal tubule, the solution which is delivered is around osmolarity of 300, then it is becoming concentrated gradually, and later on it becomes diluted over here up to the 100 millivolts, 100 osmolar. So whenever the urine is becoming diluted, means ultimately what happens is that the reabsorption of water is reduced. So this process is reduced over here. The water will not be absorbed, so amount of urine which is passed on this tubule will be more. So this is the part where the dilution of urine will take place. This is the part, descending limb of loop of Henle. The drugs which will form a dilute urine will act on this part. Okay, no much action is taken place because this is the part, ascending loop of Henle, where there is only the salts and water reabsorption will not be affected much. Only salt and reabsorption by active processes taken place over here. So the descending loop of Henle is affected whenever there is a dilute urine formation is there over there. Now here the process of a concentration of urine. Now concentration of urine means more amount of water will be getting reabsorbed. You can see over here the water is reabsorption more, but here you can see the collecting ducts, the more amount of water is getting reabsorbed over here. Then again the salt water absorption will be as usual, and more amount of water will be getting reabsorbed. So the drugs which are concentrating the urine, they will act preferably on the descending limb and collecting ducts. Here we can see now the amount, the osmolarity of the solution which is delivered in over here as a urine is around 1200 osmolar. So this clearly indicate, previously we can see over here the osmolarity is around 100. Now here in concentrated it is around 1200. So this clearly indicating how the urine concentration is taking place and urine dilution is taking place, and where they are acting were actually. So this is how we are identifying the target, that how the urine concentration can be done, urine dilution can be done. Now this is one typical mechanism which is observed over here, that is a countercurrent mechanism. It is also called as a countercurrent mechanism. You can see over here this is the loop of Henle, descending loop and ascending loop. So the flow in descending loop is towards the downward, whereas flow in the ascending loop is towards the upward. So we can see that here the osmolarity is around 300 at the beginning, and at the end it is around 100. So this creates a clear around 200 osmolar concentration gradient. So a fluid which is entering into the descending limb having the osmolarity 300 osmolar, whereas one which is going out of the loop of Henle is 100. So a small gradient is created, around 200 gradient it is established between ascending limb and descending limb, and this osmolar creates a typical osmotic pressure in the loop of Henle, and which is responsible for most of the actions which are over there. So they are responsible for water, and this difference in between osmolarity is responsible for water and electrolyte reabsorption. Electrolyte reabsorption mainly by the active transport, and water by this difference in between osmolarity. The ascending limb is impermeable for the water, so therefore the water permeability will take place only through the descending limb, and active transportation of the electrolytes by the ascending limb. So this creation of osmolar gradient moves water by the descending limb. So it creates the osmotic, and water will be coming out of this descending limb only. Now this is what much we have talked about the loop of Henle and osmolarity and all these things in terms of the how the drugs will work on that process. Now tubular reabsorption, where the next part, distal tubule and collecting ducts, the tubular reabsorption process, where the substances are taken up by the blood from the urine. So kidney have the mechanism for the reabsorption of sodium, potassium, glucose and amino acids, etc., and water, but these mechanisms are very selective. Selective means one mechanism which is responsible for sodium will be responsible for sodium only, not for the potassium. So one mechanism, separate mechanism for the potassium, separate mechanism for the glucose, separate mechanism for the amino acids. So they are having a selective reabsorption process. They are called as selective reabsorption. Solutes are selectively reabsorbed. So if you target a specific site over there, then you can selectively enhance the absorption, or selectively reabsorption or absorption can be altered by selectively. They are having a very typical selectivity, and they have the different modes of reabsorption. They are selective and they have the separate mode. So reabsorption, most of the reabsorption, around 70%, it also takes place from the proximal tubule. Glucose and amino acids, they are the highly essential molecules and they are completely absorbed and they are actively transported. The reabsorption process is mostly actively taken place. Water reabsorption, again we have already said, this is by the osmosis process they are taken place, and the protein absorptions by the pinocytosis, because proteins are very large in molecular size, so they will be absorbed by the pinocytosis mechanism. After absorption, there might be there are some secretion processes also. So large molecules which cannot be filtered from the glomerulus, they are secreted over here, and they are secreted at the tubular region. So unwanted large molecules are filtered out through the distal convoluted tubule. Secretion is they are disposed into the urine. So mainly the metabolic waste product or muscle metabolites, hormonal breakdown molecules, or larger molecule drugs or antibiotics, they are mainly secreted actively through the tubules, like sodium, hydrogen, ammonia, potassium, uric acid, vitamins, penicillin, histamines. They are actively secreted inside the tubule so that they can be disposed of. So one which is required for the secretion but cannot be filtered through the glomerular are secreted by the tubulars. So this is again the process which is present over here. Clinically, whenever the toxic substances has to be excreted, this process is playing an important role. This is the most important process whenever we have to secrete a particular substance which is a toxin in nature, metabolite in nature, toxic substances. Whenever we want to excrete as a treatment, at that time this is most important, tubular secretion, and where we are targeting the drug over here. Last process, mixturation. Mixturation is nothing but the voiding of the urine. It is one of the small portion of the urinary system. A urinary bladder, it is not from the nephron or kidney part, it is the extended part of it. A urinary bladder distends whenever it is filled. Whenever it is filled, it is pulled downward, that is distant towards the downward whenever it is full, and there are a stretch receptor in the wall of the bladder, and they send a signal of mixturation to the sacral region of the spinal cord. So due to the distension, there is a stretching of the wall, and this stretching of the receptor will send the signal to the spinal cord. So parasympathetic nerve, that is send a signal to the distress muscle, to the distress muscle, and there is a rhythmic contraction of the urinary bladder, and it is sending a sensation of a urinary urge towards the spinal cord. Then there is a voluntary contraction of external sphincter which inhibit the mixturation. Mixturation is not an automatic process. Although there is a urge of urination, we can voluntarily stop the mixturation process by the external urethral sphincter. Internal urethral sphincter will be opened by the parasympathetic nerve by to the distress muscles contraction, relaxation, and the signal to the spinal cord, but the external sphincter will be closed, and it is voluntarily. So whenever an individual decides to the mixturate, the external sphincter will be opened and mixturation takes place. So the impulse from the pons and hypothalamus will be sent to the external sphincter, and which will relax the external sphincter, and mixturation reflexes will be there which will be sent to the external muscles, and mixturation will take place. So distress muscles which is expelled, which will be contracted and relaxes the sphincter, and urine will be expelled through the urethra. This is what a little bit about how how the mixturation takes place. There are two types of muscle, internal and external urethral sphincter. Internal will be managed by the parasympathetic nerve in the spinal cord, sacral region, whereas the external will be controlled by the pons and hypothalamus, which under the control of a wheel, and which we can postpone the mixturation process. So this is what about the overall kidney and its normal functionings. This is just a rewinding of the something which has happened at the anatomy physiology subject, and some part which is responsible in connection to the mechanism of actions of the diuretics and antidiuretics. So this is what about the first part of it. Thank you very much. If you have any queries about it, you can contact me in the given phone numbers and email ID. Thank you.